Hey, thanks for making it Veterans Info Tap. I'm glad you made it. What has the VA been up to lately? Well, here's a headline, and we'll dive into it. I'll share my 2 cents along the way. The headline is Advancing the Largest Public-Private Partnership in VA's History. So remember that when the VA has these partnerships, even if they're in one geographic location versus another, the entire VA is supposed to win, right? There's the idea that the knowledge gained from these types of things is shared throughout the organization, and who benefits? Veterans as a whole, right? Is the way it's supposed to be. I already know there's a bunch of different thoughts on that, but the idea, right, is that, hey, look, they formed this partnership, great things were figured out, found out of this, found out of that, we're going to share it with the agency wide, bam, everybody's got it, everybody's on board, boom, vets are winning. Ideally. So, with that, let's jump into it. Hit the thumbs up for me. Subscribe, share with a friend, all that good stuff. I'll back up so you can get a little more of the beard. Oh, yeah. Oh, yeah. Well, it's a little lopsided, but whatever. Don't talk about it. So, that's why I get close, so that way you can't see that it's lopsided. I'm due for a trim. All right, so, thanks for indulging me. Let's move on. I'm a little bit exhausted, so that's why. I know you guys get it. I try to stay on it and stay, what's the right word? Reliable. I guess I'll just share it real quick. I know you probably don't care at this point, but when I started doing this to push out the information, I already knew that there was a lack of, just not a lack of information, just a lack of resources out there that kind of put it all together in digestible pieces for all of us, right? By somebody who actually gives a darn about us. I talked about it for a long time, and so finally I did it. So when I did it a year ago, coming up on a year anniversary from starting the channel, thank you to all you subscribers. I really appreciate you. Thank you for everybody who watches and doesn't subscribe, because some people just don't. But I need the subscriptions because it does help, so thank you. Helps the channel, helps us all, right? Many hands, light work. When I started it, I started it and I said, you know what? I'm in. I'm committed to doing this for all of us, and I will continue to lean forward until I have gray in my hair. Haha! Because it's all here. I don't know why. And just so everybody knows, look, my wife won't let me cut my beard. She knows what's underneath. So, let's move on. The headline here is Advancing the Largest Public-Private Partnerships in VA's History. And look, just so you know, I'm talking because we're all brothers and sisters, right? I mean, we all chewed some sort of dirt somewhere, and I love each and every one of you. So let's move on before I start to get weird. Our core mission of strengthening academic partnerships. So this just came out a couple days ago. I wanted to share it with you. All right, last month in Tulsa, Oklahoma, VA's National Academic Affiliations Council met at the Ernest Childers VA Outpatient Clinic to further advance the largest public-private partnership in VA's history, harnessing many of its diverse partnerships to meet their goals. So, again, they're speaking Oklahoma, but when they figure something out good for us, then it gets spread through all. So we all win, right, is the thought. So the 14-member council meets quarterly to create recommendations and advise VA leadership on matters affecting relationships between VA and health professions community. The health professions community. It's been a long... I'm exhausted. All right. Participants including VA offices of Indian Health Services, Oklahoma State University, and Cherokee Nation. Dr. James Hildreth, Meharry Medical College president and chairman of the council, spoke of the importance of enhancing partnerships to accomplish the council's mission. This council meeting was of particular significance as we join with many different organizations to better our partnerships with academic affiliates and reshape the VA healthcare system for continued excellence. I've enjoyed the collaborative effort and look forward to seeing policy enhancements based on the council's recommendations. That was his quote. Moving on, as part of the meeting, council members received tours of the Oklahoma State University's College of Medicine at the Cherokee Nation W.W. Hastings Hospital and the Cherokee Nation Outpatient Health Center there in Oklahoma. The tours highlighted the importance of various organizations such as the VA, academic affiliates, and local communities working together to better health care practices. Office of Academic Affiliations Chief Academic Affiliations Officer Dr. Marjorie Bowman spoke of the incredible work that comes from the council collaborations. It's all about asking, how can we make a difference for veterans and for our country? This meeting was truly rejuvenating in bringing us back to the core mission of making and strengthening those academic partnerships to better health care in our nation, Bowman said. The mission of training future health professionals for VA and the nation, established more than 75 years ago, is one of VA's 4 missions. Oh, I never knew. Nearly 70% of U.S. physicians complete training in a VA facility, and more than 118,000 health professions trainees in over 60 clinical disciplines train at VA each year as they care for veterans. And look, I get the argument, right? Train on the veterans. Oh, look, they're going to train somewhere anyway, right? There's residencies all over the place. So just VA happens to be the biggest healthcare network, right? Provider. And so obviously they're going to have many of these types of partnerships. So, yeah, pretty interesting. That's cool. And again, something that I didn't know about, and now hopefully if you didn't know about it, now you know about it. I appreciate, if you hung on till the end, I appreciate you hanging on at the beginning. Have a great one. I really appreciate each and every one of you. Thank you so much for your subscriptions, your likes, your memberships, all that stuff. It really does mean a lot to me every single day. I enjoy seeing the comments as well. Thank you guys so much. I appreciate it. And remember, if we don't take care of each other, something went wrong.